We can see your slides. You can start.
Hello, doctors and professors. My name is Guoqing from Department of Ultrasound, China Japan Union Hospital of Jilin University. And today, I'd like to share my experience about the efficacy and safety of microwave ablation for the treatment of thyroid and breast nodules. My report mainly covers three aspects: microwave ablation, MWA for thyroid nodules, and MWA for breast nodules. In recent years, the prevalence of thyroid and breast nodules has increasingly annually. The detection rate of thyroid and breast nodules has increased to 65% in the general population, and 90 to 95% of the nodules are benign. In most cases, benign thyroid and breast nodules are simply followed up and monitored. However, some benign nodules may require treatment when patients have related symptoms or cosmetic problems. What kind of treatment should we take for these nodules? Although surgery is widely used and effective, it may be associated with significant incidence of post-operative complications and unsatisfactory aesthetic effects. Some patients must take medications for life after surgery, which affects their mental health and quality of life. Therefore, increasing numbers of patients are seeking a minimally invasive treatment alternative to surgery. Thermal ablation methods such as laser, radio frequency, and microwave ablation, also called MWA, are being used more extensively in clinical practice due to their advantages, such as reduced trauma and no scarring. MWA is characterized by rapid heating, good coagulation, a large ablation area, and relative ease of use, and is currently used to treat tumors of liver, kidney, lung, and uterine fibroids, as the report of Dr. Tim, and other solid tumors. In recent years, researchers have gradually adopted the use of MWA to treat thyroid and breast nodules. Studies have shown that ultrasound-guided MWA is safe and effective for the treatment of thyroid and breast nodules. Moreover, researchers have investigated MWA versus surgery for the treatment of benign thyroid nodules and breast nodules. There are studies have suggested that MWA can significantly reduce nodule volume and nodule-related symptoms and provided a recovery and more satisfactory aesthetic outcomes with less physiologic disruption and a lower cost compared with surgery. Microwave is a kind of high frequency electromagnetic wave. Polar molecules in tissue will oscillate and collide with each other, and the action of microwave to generate heat energy. The current microwave therapeutic apparatus can form a ellipsoid solidification zone with a diameter of about 3 to 4 cm, a central temperature of over 100 degrees Celsius, and a peripheral temperature of 54 to 60 degrees Celsius. The ablation process requires an ultrasound device with CEUS function. Sonoview was used as the ultrasound contrast agent, which was diluted in 5 ml of 0.9% saline and mixed well by shaking before use. A 4 ml bolus was injected into the maiden capital vein. The MWA instrument we used in the eGo machine. Superficial organ ablation needle made in Nanjing, China. All patients send an informed consent form before MWA, and all patients were confirmed pathology by core needle biopsy. All patients underwent laboratory tests before treatment, including thyroid function and coagulation. Patients taking anticoagulants were required to discontinue these medications 1 week before treatment. All patients underwent routine ultrasonography before treatment to evaluate nodule size, location, composition, and vascularity. Before MWA, we developed the treatment protocol according to the volume of nodules and predicted the required number of ablation layers and needle insertions. CEUS was performed before MWA to determine the location of nodule feeding arteries and developed an optimal ablation path. This area. If the nodule was next to the ipsilateral recurrent laryngeal nerve or large vessels in the neck, we use the hydrodissection. Use the saline to inject to the nodules in order to separate the vascular and nerve. In the ablation power is set to 30 watts. 1 minute of the ablation can form a 7 mm ablation area. According to the estimated results, the multiple overlapping the short technique was used to perform ablation layer by layer. For each layer, ablation was performed from deep to shallow surfaces and in a distal to proximal direction. When the ablation position was confirmed, MWA started after the whole active tip was placed within the nodule, and the initial power was set to 25 watts. The electrode was not moved at the beginning of MWA until the nodule showed an obvious hyperechogenic vaporization area. CEUS was performed immediately after ablation to evaluate the ablation area. Ablation was completed. Once the lesions had been completed, inactivated and no residue lesions were observed. Otherwise, ablation was repeated. After MWA, the patients were followed up for 12 months. The ultrasound examination are evaluated at 1 day and 1, 3, 6, 9, and 12 months after MWA, and laboratory tests, symptomatic and cosmetic scores are evaluated at 1 and 12 months after MWA. The following three are the possible complications during the MWA: voice change, bleeding, and pain. The voice change will disappear after 1 to 3 months. When the bleeding and pain are present, we can use the homeostatic and painkiller respectively. The next part of my report is microwave ablation for the treatment of thyroid nodules, including benign and malignant. The incidence of thyroid cancer is increasing year by year, with more women and men than men, and the mortality rate has not changed, benefiting from the early detection by ultrasound scanning. The New England Journal has published articles on the diagnosis and treatment of thyroid cancer, and people have overlooked its endocrine function during the diagnosis and treatment process. More and more patients are joining the ranks of long-term medication. The 2015 American Thyroid Association Management Guidelines for adult patients suggest that surgery may be considered for benign thyroid nodules if they are larger than 4 cm, causing compressive or structural symptoms, or based on clinical concern. That's the inclusion criteria. The nodules are associated with pressure symptoms or clinical concern. Treatment was sought because the nodules affect the patient's appearance. Clinical observation as a treatment approach was rejected due to the patient's concerns about the effect of the nodule on normal daily activities. The nodule volume increased rapidly. That's the benign thyroid nodules. The malignant thyroid nodules is papillary thyroid microcarcinoma, also called PTMC. The exclusion criteria is abnormal contralateral vocal cord, severe coagulation disorders, severe cardiac or pulmonary disease. Let's look at this case, a female, 54 years old. That's a benign thyroid cancer. With a volume of 74.9 cubic centimeter. a large mass in the right lobe of the thyroid gland. We start from our ablation from the root of the nodules. When the high echo area is occurred, we remove our needle. The ablation power was set 25 volt and the time was 20 minutes. During the ablation, the Guoqing area of the recurrent laryngeal nerve should be avoided to be injured. CEOS was performed immediately after ablation to evaluate the ablation area. You can see no blood rush into the nodules. 1 month after MWA, the ablation area was 51.3 cubic centimeter in volume. The volume reduction rate after 1 month was 32.4%. 3 months after MWA, the ablation area was 32.6 cubic centimeter in volume, and the VRR after 3 months was 56.5%. 6 months after MWA, the ablation area was 19.9 cubic centimeter in volume, and the VRR after 6 months was 73.7%. The next patient is a female, 53 years old. A large mass in the left lobe of the thyroid gland, rich blood. Color Doppler ultrasound showed a large mass in the left lobe of the thyroid gland with a volume of 20.1 cubic centimeter. The maximum diameter is 4 centimeter. We also start from the root of the nodule. The nodule was ablated. The ablation power was 25 watts and the time was 20 minutes. One month after MWA, it's a very significant reduction in the volume. Six months after MWA, the ablation area was 2.3 cubic centimeter in volume. The VRR after 6 months was 89%. 12 months after MWA, the ablation area was 1.4 cubic centimeter in volume. The VRR after 1 year was 93%. We performed MWA on benign thyroid tumors larger than 4 cm. This is our research published in 2020. Our results showed that MWA is a safe and effective treatment measures. We also conducted a meta-analysis on MWA treatment for benign tumors of the thyroid. The same conclusion was reached. This is a patient with PTMC. Here is the tumor. Near the trachea and the posterior capsule of the thyroid gland. We plan to perform MWA on this patient. We perform a CUS before our operation to evaluate the size, location, relationships of the tumor. We use the hydrodissection technique to separate the tumor from the trachea and the recurrent laryngeal. That's the needle we inject 0.9% saline. Then use the antenna insert in the center of the tumor. That's enough saline to protect the nerve and the trachea. When the antenna inserts the center of the tumor, we can start the ablation machine. Set the machine 25 volt. When the high echo area is occurred, the ablation is over. Immediately after the operation, we perform a CUS to evaluate whether the ablation area is enough. If this area is not satisfactory, we can repeat our ablation. We also conduct a 3-year follow-up study on MWA of PTMC. This article published in 2018. Our research showed that MWA is a safe and effective treatment for PTMC. We also conduct a 5-year follow-up study. on MWA of PTMC, published in 2020. Our research showed the same conclusion. We also conduct a large cohort follow-up study on MWA of PTMC, published in 2019. Our research showed that MWA is a safe and effective treatment for PTMC. Our research showed that the area of ablation is obviously reduced or disappeared. The third part of my report is microwave ablation for the treatment of breast nodules. We only use this technique in benign breast nodules. Some researchers began to research this technique used into malignant breast cancer. We give a CNB to the breast nodules. Almost all our patients are fibroadenomas. The inclusion criteria is single nodules. The size is larger than 1 centimeter, or multiple nodules, or the patient has a strongly willingness to treat the nodules with MWA. That's the nodules in the breast. We give a ultrasound examination pre-operative. A color Doppler ultrasound to evaluate its feeding artery here. We also perform a CUS before the operation to evaluate the feeding blood. We can see the blood rush into the nodules from here. The pathology is fibroadenoma. We also use hydrodissection to separate the nodules from the muscles and skin. We use a thinner insert into the nodules. We first ablation the area of the feeding artery from the deep to the surface, layer by layer. If the high echo occurred, we remove our needle. Then the next layer. Until the whole nodule was ablated. We perform a CUS immediately to evaluate whether the nodule was ablated completely. We can see no blood rush into the nodule. so it was completely ablated. The next video here is 1 day after the ablation. We can see the ablation area is enough. The next patient was a nodule in the breast. You can see the feeding artery is here. After the ablation, we can see the 1 day, 6 months, and 12 months follow-up picture. We can see the ablation area is obviously reduced. The next nodule is here. We also collected 1 day, 6 months, and 12 months picture. We can see the ablation area is gradually reduced, almost disappeared at 12 months. The next patient is here. This is the preoperative picture and the 3 months ablation area. In the 6 months, we gave a CUS. There is no blood rushing into the nodule. At 12 months, the ablation area is not disappear. So we gave a biopsy, CMB. The pathology result is fragmented organizations. Prove the nodule is ablated completely. That's the conclusion. MWA is a safe and effective treatment for benign thyroid nodules. MWA is characterized by a faster recovery, fewer complications, better protection of thyroid function, and superior aesthetic results relative. MWA may become an alternative to surgery in clinical practice. The above is what I want to introduce. Thanks for your listening.
Thanks, Professor Sui. And we have also collected some questions in our chat box, and from the in the order that our participants have asked. The first one is, can we do microwave ablation for parathyroid lesions like benign adenomas? 水教授，这边有医生想问的是，就是关于甲状旁腺这个结节的治疗，微波是不是能做的呢？比如说这种良性的甲状旁腺腺瘤 ，please。水教授，如果你想说什么的话，你可以用中文说，我也可以帮助翻译一下。
我电脑出了点问题。
Okay. There is some problem with the Professor Sui's computer, so maybe we can just wait for a few minutes.
we have some experience in thyroid glands disease. This technique can also be used in thyroid disease. The hydrodissection technique also be used in the MWA procedure to protect the nerve, vascular tissues and trachea. It's also a safe and effective method to treat this thyroid nodules. Thank you.
Thank you, Professor Sui. Professor Sui has said that the microwave ablation can be also used to treat the parathyroid lesions, and we can also use the hydrodissection technique to protect the nerves, vasculars, and other normal tissues due to the ablation. And Professor Sui, and is it always necessary to use CEUS before and after microwave ablation? 水教授，请问一下，就是在做微波消融甲状腺结节前后，是否有必要总是就是需要这种超声造影呢？就普通超声可不可以呢 ？Please.
We perform CUS in thyroid before preoperative and after-operative routinely. Maybe if you have enough experience in microwave ablation in thyroid nodules, maybe you can maybe you can do not use CUS, but at the first if you don't have enough experience, CUS is necessary. Thank you.
Thanks, Professor Sui. And also for another question, what do you do for a large nodule if it doesn't significantly reduce in size after microwave ablation, reduce around 30%, but mass effect is still present? So can we do repeated ablation? Any tips for ablating large lesions? 水教授，这边有医生想问的是关于大结节这个消融，如果就是在消融以后，这个体积收缩的不是很明显的话，请问是不是可以再次重新做一次消融呢？就是2次消融呢？然后就是关于大结节的消融方面有什么建议呢
？My suggest is if the nodule is very large, we try to ablate the whole nodules. If the whole nodule was ablated, the nodule will be reduced significantly. If there is some some part of the nodule do not be ablated, it may reduce no significantly. So the next operation may be required.
Thanks. Thanks for your detailed explanation. And Professor Sui, for the hydrodissection, dextrose and versus saline, which can be used? 就是水教授，就是请问，就是在注射这个隔离液的时候，一般是用葡萄糖呢，还是用生理盐水比较合适呢
？We use biological saline 生理盐水。
Okay. Yeah. 1%.
0.9% saline.
7.
就是0.9%的生理盐水。
Okay. I got it. And Professor Sui has said that for the hydrodissection liquid, he always used the normal saline. Normal saline is very enough, not the dextrose. And the normal saline is 0.9% saline is enough. And Professor Sui, and I also want to ask that for the microwave ablation, if there are 2 hot nodules in one lobe and 3 hot nodules in other lobe of thyroid, then what will be your treatment plan? 就是水教授这边想问的是，就是关于甲状腺这方面，就是如果一个侧叶里面长了2个热性结节，然后另外一个侧叶里面又长了3个热性结节，就是关于您这方面的话，有什么相关的一个治疗方案呢
？If the situation like this, we treat all the nodules in one time.
If there are 2 nodules in one lobe or 3 hot nodules in other lobe, Professor Sui can suggest that we can ablate those nodules once. Yeah. And Professor Sui, about the breast microwave ablation, what power you used? 水教授，请问关于乳腺消融这一方面，一般你用多大的功率呢
？25 watt, as the same as thyroid nodules.
Thank you so much. And Professor Sui, about the thyroid microwave ablation, any tips to avoid injury to the recurrent laryngeal nerve? 水教授，就是请问关于甲状腺消融这一方面，就是对于避免这种喉返神经的这种热损伤，您有什么建议呢
？This problem is very good. I introduce my experience in the PPT. In my report, we use the hydrodissection technique, inject the normal saline into the thyroid and the under the trachea to provide the to separate the thyroid and the trachea and the posterior capsule of the thyroid, so we can protect the recurrent laryngeal nerve. Thank you.
Thank you so much. And Professor Sui has said that for avoiding the thermal injury to the recurrent laryngeal nerve, he always injected the hydrodissection liquid around the thyroid gland, the trachea, this area, to reduce the risks of to hurt the recurrent laryngeal nerve. Yeah. Thank you so much. And we still have another question, as you can see here. Professor Xu, how about the microwave ablation can be, whether the microwave ablation can be used for the follicular adenomas? 石教授就是请问，就是关于微波消融是否可以用于治疗这种滤泡状的这种腺瘤呢
？We don't suggest this case use microwave ablation because we can't diagnose the nodule is benign or malignant, so we suggest surgery to this case.
Thank you, Professor Sui. Professor Sui has that for the treatment of the follicular adenomas, this situation is not suggested to be done under the microwave ablation procedures. Surgery is a good option. And thank you so much, Professor Sui. These are all the questions we collected here. Thank you so much. Thank you for your detailed explanation. And thank you, everyone. Thank you for your time. Thank you for joining us. Maybe it's the end of our webinar today.